Novartis confirms death of 2 children treatment with gene therapy at Zolgensma. 2 children have died of acute liver failure after treatment with Novartis therapy at Zolgensma. The pharmaceutical company Novartis has already confirmed this. That could further heat up the discussion about the controversial gene therapy and scratch the company's image. Investors also react to the news with a call as shown by price losses on the 6 of 0.91% at times to Swiss francs 80.30. The papers from competitor Roche are meanwhile picking up. This suggests that investors are shifting their money from one Basel group to another. According to the market, after all, Roche has a direct competitor to Novartis. Gene therapy is its drug Evrysdi. Both are used to treat spinal muscular atrophy, a rare inherited disease that is in most several forms is often fatal by the age of 2. However, the gene therapy only has to be administered once, while Roche drug has to be swallowed daily. Above all, however, the 2 drugs differ in prices. Novartis therapy is only to be one of the most expensive therapies in the world, at all prices of around $2 million. Roche remedy is cheaper at first glance. The annual treatment costs are almost over $340,000 per year. However, the drug must always be taken for life. Deaths are likely to fuel discussion. This news is likely to fuel discussion about gene therapy again. Octavian analyst Michael Neffron commented on the news in an interview with the AVP news agency. There have been a number of setbacks in this area over the past 2 months, making the patient and investors even more sensitive to so much news. Novartis itself announced in a statement on the deaths. In accordance with health authorities, will be updating labeling to instances of fatally acute liver failure. It's been reported. As expert Norwood explains, it's also important that these are the first deaths of this kind. One must wait and see whatever more will follow, or whatever these cases will remain. Also, by a channel with therapy, it can be assumed that some patients are now perhaps a little more cautious and prefer to rely on one of the alternatives to Zolgensma. And the Novartis, in addition to Roche, Blogene also offers a therapy. The stock exchange trading, on the other hand, the market participation emphasized that the deaths had to be put in relation. After all, more than 2,000 children have already been threatened with the therapy. Novartis itself emphasized in the statement that they continue to believe in the overall favorable benefit-risk profile of Zolgensma. Acute liver failure is a known side effect that has been reported following treatment with Zolgensma. The 2 patients have been treated with steroids using the managed safe risks a few weeks after Zolgensma therapy. Octavian analyst Norwood also noted that new side effects appeared while any drug in its nearly years on the market. Both Norwood and another expert see as a positive sign that Novartis is making no move to take the therapy off the market. Expansive purchase volume. Zolgensma was approved in the US in May 2019, making it only the second gene therapy for an inherited disease to be approved by the US Food and Drug Administration. Novartis itself added the therapy to its portfolio by acquiring Avexis in 2018 for almost $9 billion. Again and again it was completed that the group had bought the therapy too expensively. With sales of $1.3 billion, Zolgensma was one of the top 20 drugs in Novartis' portfolio last year. Novartis may use radioactive therapy in the UK. The pharmaceutical company Novartis had also received official approval in the Great Britain for its radiation therapy, Luthio. This decision does not come as a complete surprise after the advisory authority, MHRA, Medicines and Healthcare Products Regulator Agency, had already spoken out in favor of approval in April. The therapy is used to threaten patients with a special form of prostate cancer. Radiology therapy is a new treatment approach that could present an alternative treatment option for some cancer patients. Novartis company Advanced Isolator Ablations announced on Friday that targeting the compound is combined with a therapeutic radioactivity at home. The RLT is said to be delivered through the bloodstream and delivers target radiation to a cancer cell in the body, with the aim of limiting damage to surrounding tissue. What do you think about the two deaths? Should they continue to sell the drug?